Hi, everyone. Welcome. Hopefully you're in the
Morning, afternoon, evening, wherever you are.
hopefully you're in the right breakout session for you. This is Kim and Elizabeth, and we're going to talk about do an intro of our Heartland protocol screening for maternal mental health disorders.
So we're super excited that 2020 Mom invited us to present. We've been admiring this organization for years and feel super excited to be a part of it. Today's presentation is going to be focused on an overview of our Heartland protocol, and we will have time for questions in the end. If you want to get those questions off your mind and into the chat, that's great. And then we'll leave some time at the end to ask. However, if we're saying something and you want to ask a question during for clarification, don't hesitate to ask. We'll get to questions whenever it makes sense. So like Kim said, we are from Heartland PMAD Consultants. We're based out of St. Louis, Missouri, in the heartland of United States, but we serve healthcare and mental health care providers all over the globe. And we wanted to let you know who we are and why the heck we're here talking about PMAD. So to give you just a brief outline, I'm a MSW, LCSW. I'm licensed to do therapy in Missouri and Illinois. And I started my career in the domestic violence, intimate partner violence world. And I did a lot of trauma work affiliated with prosecutorial offices, law enforcement, and victim advocacy. I received my MSW in my hometown of St. Louis at St. Louis University. And then I went on to do a lot of work in healthy sexuality, working with Planned Parenthood and working with clients that have acute HIV/AIDS. And then I transitioned into working in trauma therapy, working with young women and girls at a residential treatment facility, and then did several years designing group therapy curriculums, working with individuals that have been affected by IPV, and starting a teen therapy program. And then I started about 9 years ago, my private practice called Stage 3 Therapy, and we specialize in working with moms. So I took all of my trauma therapy and trauma advocacy background, and I've applied it to working with PMAD. I found that it's really a very good fit to use all of my trauma-focused cognitive behavioral therapy methods with moms and parents who have experienced traumatic births, pregnancies, or are dealing with clinical diagnoses postpartum. So Heartland was founded, I don't know, we probably should pay attention to when that officially was born, maybe 5 years ago. And Kim and I have known each other professionally and personally for years. I took a childbirth class from her during my first pregnancy over 16 years ago. And I also adjunct with the Brown School of Social Work at Washington University here in St. Louis, and I serve on the board at the Hyperemesis Education and Research Foundation. Those last couple mentions are directly related to the personal experience that brings me to this work. So you'll see some pictures of me and my family on the side margin. So I became pregnant in 2005 with my daughter Claire, and I almost immediately started having symptoms of significant hyperemesis, which is a pregnancy-related illness that is nothing like morning sickness, but it does involve nausea and vomiting. And I was super, super sick with my pregnancy with Claire. I took a childbirth class with Kim in the hopes that I would be able to do an unmedicated birth. And I wanted to work on my birth plan and just have some education with my husband and I. Unfortunately, I didn't get anything I wanted on my birth plan because I had such a high risk pregnancy. I was in and out of the hospital. I had lots of at-home health interventions. and I delivered my daughter almost about a little over 7 weeks early due to preeclampsia and HELLP syndrome, which was super, super scary. Claire, thank God, did very, very well in the NICU, and she was released 15 days later. And she's now happy and healthy, a sassy, almost 16-year-old, and she's doing great. I became pregnant with her little brother about 5 years later. It took me a good 5 years to get the guts to do it again, because the likelihood of getting hyperemesis a second time is very high. Luckily, I had very good obstetric care, and my OBGYN treated my hyperemesis fairly aggressively. However, I was just as sick, if not sicker, with my son, James, and I needed a PICC line. I was on bed rest for the last probably 4 months of pregnancy. And so as a result of these two very similar pregnancies and deliveries and NICU stays, James was also in the NICU, I definitely had my fair share of postpartum PTSD. I also had postpartum depression, and I exhibited some postpartum OCD symptoms as well. It was during my second pregnancy, when I kind of knew what I was getting into the second time, that I wanted to be really proactive with getting some counseling. And I had a really hard time finding it. I had a hard time finding somebody that would understand that I really couldn't leave the house, that what I was experiencing wasn't just like traditional morning sickness, that I was at risk for PMAD, and that I needed some very specialized help. And that's what led me to doing this work. I wanted to make sure that I was working with moms that were at the most risk for being affected with perinatal mood and anxiety disorders, particularly PTSD. So that's what brings me to do this work. I'm very grateful that both of my kiddos are okay, but it took me many years to get closer to being okay with all of the mental health and physical health issues that my hyperemesis caused. So that's my passion. That's why I'm here with you today. And now we have Kim. Oop, you're muted.
I know, I muted myself because I was coughing and forgot. Hi, everyone. I'm Kim Martino Sexton, and you can see I'm older than Elizabeth. We'll just put that out there. So I've had a lot of experience, which just happens when you're older. Um, so I started off in my life, my career, working in higher ed, and had no desire to be a mother or do anything motherly. so, so there's that. And uh, um, and so let's see, once I had my first, I took a 12-week childbirth education class, which was hugely helpful because I had quite a bit of anxiety during the pregnancy, undiagnosed, didn't quite know what that was, and nobody really talked about anxiety back then. Um, but as a result of my anxiety, and we'll talk about my births and my experience in a minute, I then moved into this whole world of childbirth education, attending births as a birth doula, supporting families as a postpartum doula, became a peer parenting coach, found out about maternal mental health, and started working in that area. So I've spent the last 25 years in uh, doing all the things around pregnancy, birth, and maternal and actually family mental health. So the last uh, few years, I actually owned my own birth services business for about 5 years, and we had a stable of postpartum and birth doulas, and it was very fun and exciting. Um, but I really wanted to concentrate more on the work that Elizabeth and I had started. And so, and like Elizabeth said, we met when she took my childbirth education class way back when. I still do teach childbirth education classes. It's called Calm Confident Childbirth. And like everything else these days, it's a hybrid of on Zoom and in person. so, um, and And then I also work with a small nonprofit within a big nonprofit. So I run a program called the Mom's Line, which provides peer telephone support and peer facilitated groups for moms experiencing any form of perinatal mood and anxiety disorders. And um, so I think that's all I'm going to say there about my experience. We can move to the next one. So my personal story, as I mentioned, I wasn't going to be a mom. That wasn't a thing I thought was going to be part of my life. And then my partner and I got pregnant, and I was like, well, I guess we'll do this thing. How hard could it be? He's a rocket scientist, and I worked in higher ed, was responsible for orientation and leadership and programming at a university. Um, and so it was like, well, a baby, how hard could that be? And it turned out to be really hard. We had a great birth. We had taken a Bradley method childbirth education class, and we were ready for the whole natural thing, hoping for it, had a doula and all the things. And that went really well, surprisingly, because I really wasn't sure that I could do this whole natural thing, but we did it. Um, but no one had ever talked to me about the depression, anxiety, or any of that during my pregnancy or even postpartum. And so when I remember distinctly experiencing the baby blues and talking with a friend of mine who had a baby about 4 years before I had my first, and she was like, "Oh yeah, that's the baby blues." And I was like, "What are the baby blues?" And so she kind of told me. I was like, "Okay, fine." And then they never seemed to go away for me. They just got worse and worse. Um, and at my 6 week appointment, I tried to talk to my OB about it. And he was like, it's just normal. Lots of moms feel that way. And so as soon as your baby sleeps more, you're going to feel a whole bunch better. So I continued on and called my OB when I had gone back to work at about um, at 4 months, because I had a wonderful insurance and was able to stay home for 4 months, and went back to work. And I was struggling while I was at home, went back to work, and it was even harder to function. And talked to my OB, and again, he's like, just try to keep getting plenty of sleep and get some exercise and make sure you're getting, plenty of sun and all kinds of good things. And I was like, okay, I'll keep doing that. Um, and it got to the point where I was pretty much almost like completely debilitated. Like I could barely function at work. And so I gave notice and spent about 8 months wrapping up my position and getting ready to leave a job that I absolutely loved and a career that I had planned to stay in, to work from home, um, and pursue just a small um, piece of a business that I had created. Um, but to get out of the 80-hour a week university life, because I thought, well, that must be what the issue is. Well, it turns out it wasn't. Actually, my depression got much worse when I was staying home. And it wasn't until mom moved in next door that um, I really found out that other women were having similar experiences. This mom moved in, she had a son exactly the same age as my son, 17 months old at the time. And I was like, "Hey, how are you? And I'm so glad you moved in next door." And she was like, "I'm not doing well." And I was like, "Me neither." And so we ended up finding peer support. And that was really the beginning of my healing journey. And then in between my first and my second, I had several miscarriages, which again, my OB said, that's just normal. Women do that. Never talked about the um, mental health side of miscarrying, and then what it might be like once I was pregnant again. And I had a lot of anxiety during my pregnancy, which didn't really talk about. I was in therapy, but not with a mood and anxiety disorder therapist, although she was a good therapist. But um, I think we missed a lot because we never really talked about my miscarriages or how this might affect me. So after the birth of my second, almost 5 years later, I got to experience very high anxiety um, with uh, intrusive thoughts and some OCD tendencies, and um, took a lot less time to get help because I knew where to go. So within 3 months, I was getting the help that I needed. Um, and then I've been just on a journey of recovery pretty much ever since. My kids are 21 and 26 years old. Um, uh, but it started with peer support and then lots of different types of therapy. Medication was part of it. And then I think this whole career that I now have has been, just an ongoing part of my recovery journey, trying to help make sure that other moms, hopefully don't suffer as much as I did, or if they are, that we, can help them get connected. So that's why I'm here. By the numbers. So I'm aware that you have all been hearing about the numbers throughout the conference so far. Um, but we do just want to make sure when we're talking about the work that we're doing, um, these numbers influence our work significantly. So knowing that 1 in 7 moms will experience some form of a clinical condition, that 1 in 5 moms experience some form of mental health or substance use disorder during pregnancy, knowing that we lose so many moms each year to depression caused by maternal suicide, is a big part of why Elizabeth and I do the work that we do, trying to work with providers so that we can get moms supported and get them help as soon as they need it so that they're not waiting and struggling. Um, Hopefully you all just got to see the um, the keynote address and watch the movie Top Toxic, which went into lots of the disparities. So for Elizabeth and I, we live in St. Louis, Missouri, which has um, some of the highest Black maternal and Black infant uh, uh, rates, in terms of death for both moms and babies. We lose over 450 babies a year here who don't make it to their first birthday. Um, and so we live in an area where it's really critical for us to be looking at all moms, talking about all moms, and especially our Black moms and moms of color who are living, if you watch the movie, who are, living under those conditions every day, with disrespect, not being seen or heard. And so that's a big part of the work that we do to make sure that all moms are heard, but especially focusing on our moms of color. And so that's brings us to the protocol we created in an effort to help providers hear moms. Elizabeth and I have both heard from hundreds and hundreds of moms who weren't heard, didn't get connected to the care that they needed. And that's still happening today. Part of the work that I get to do with the Moms Line, we have a peer helpline. So moms can call us and 24 hours a day, leave a message because we're not an emergency line, we're not a crisis line. But leave a message and then we'll connect them to peer support and other levels of support if they choose. And there isn't a week that goes by that I don't hear from a mom who has said, I just told my OB or I called and I'm trying to get some help. And they said, I'm either past the time because they've already had their 6 week checkup. So now they need to find another provider to get help for mental health issues. Um, or, her doctor told her to go ahead and get some more rest and make sure you use lavender because that will help. And sleep and lavender will help. However, um, we know that it's much more than that, and moms need to be heard, to sit with someone who understands and is empathizing, doing more than just the paper assessment, and then There's definitely specific ways to help refer moms during pregnancy and postpartum to make sure they get the help that they need. So our wraparound protocol was created to help providers quickly and easily be present with moms and help them get the care they need.
So these 5 steps of the Heartland protocol, none of these will be new to you. They're all things that at some point in time, most, if not all, providers are doing. Maybe they're doing additional steps, maybe they're only doing a couple steps at a time, but these are not totally foreign concepts to anyone that works with the perinatal population. What Kim and I have learned over our years of working with moms in systems such as hospital settings or residential treatment settings or private practice or counseling centers or insert agency here. What we've learned is the importance of doing these particular 5 concepts in the order that we have it presented to you, and making sure that in each category, in each concept, each step, the HEART, that you're doing them with evidence-based practice and best practices in mind, so that you're thoroughly, but yet quickly and easily delivering the most effective services to the moms and families that you're working with. So a common question that we get is, well, who is this protocol for? Like, for instance, maybe someone isn't a therapist, such as myself, and says like, well, I don't want to be doing therapy. That's not my role. I'm an OBGYN or I'm a birth doula or what have you. I shouldn't be doing therapy. And the cool thing about our Heartland protocol is that you can apply these 5 components to any profession that is mom facing. So, therapists may dive really, really deep into some components like empathy and hearing. But every professional can do these 5 things and know that they're helping to prevent moms that are getting missed and getting lost in the system. So since we get this question a lot, and we want to make sure that everyone has access to this protocol so that we can save more moms and babies, we developed kind of like a self-assessment to see if this is something that you would benefit from, to have a more depth training or learning experience with the Heartland protocol, which is something that we offer throughout the year. So if you could grab a pen and just any kind of scratch paper, we're going to walk you through a brief assessment to see, how close to home the reasons why we developed this protocol are hitting nonviolently, are affecting you guys. So for starters, I'm just manipulating my screen so I can see. So are you ready for the Heartland protocol? So you're just gonna make a check mark every time you respond yes to the question, okay? It's a real simple 6-question assessment. So number 1, do you feel spread too thin? Are you constantly distracted or overwhelmed at work? Like you're working all the hours, but none of the work is paying off? Yes or no? Number 2, do you find yourself unsure of how to properly intervene with a client who's developing symptoms of a perinatal mood and anxiety disorder? Do you feel unsure when that comes up? Number 3, do you worry your clients aren't telling you their full story and they're holding back for some reason? Number 4, is it scary to think that you may miss something important about your client and they won't get the help they need and deserve? Number 5, you keep waiting for that perfect, comprehensive community organization to pop up so you can refer all your clients there and then they'll get better faster. And number 6, deep down, are you beginning to feel like you've been focused on fixing the problem instead of just being present with your client and listening to their story? Okay, pretty simple. Okay, so what does all that mean? So tally up how many yeses you checked off. And if I'm going to go back from the bottom up. Let's say you have 0 yeses. Then that might mean that, you can't remember the last time your to-do list didn't get fully checked off and you're always leaving work with a smile on your face. And for that, I congratulate you and applaud you. And I want to know your secret. Please post it in the chat.
Right.
No judgment,
We want
but
to
that's
know,
awesome.
how are you doing that?
How are you doing that? Because that sounds, I want to sign up for that. If you just checked off 1 yes, something needs to change, but you're not sure what exactly, and then if you've checked off 2 or more yeses, you've been ready. Like you showed up ready. You recognize that you and your clients deserve more. But it's fair to say that maybe that more sounds exhausting. So how sometimes we may know we need to be doing something different. And we want to work like smarter and not harder for ourselves and for our clients, but that just the idea of it makes us want to cry. Like I can relate to that. So I'd be curious to see what you all score. If you have a minute, if you pull up your chat and just let us know how many yeses you scored. I'm curious to see where everyone is. So the good news is none of those questions, none of those issues that were brought up in those 6 questions, those aren't actually the real problem anyway. Like the real problem, the root of the problem. They are things that take up our attention and time and like, they need to be addressed, but they're not like the root of the problem. So the even better news is that that's why Kim and I developed this Heartland protocol, is because, part of the efficacy of the Heartland protocol is it helps each professional get to their why. Like, why am I doing this work anyway? Like, why is this even important? Why do I want to work smarter and not harder? And so this is something that we want you all to be thinking of, certainly today during our presentation, but even this week at the 2020 Mom Forum. Like, I think we all want to get in better touch with our why so that we can do a better job. And not to say that we're not already like totally doing a really wonderful job, but can we all benefit from kind of tweaking and polishing up the skills that we've used? I say definitely. I mean, I've been in the field for over 16 years and I'm still learning. So part of what we're going to talk about today in relation to the Heartland protocol is what are the 4 most common things that we see providers getting stuck on that leads them to, coming to one of our 2-day trainings to learn more. Like, what do we, no matter if we're talking about psychiatrists, case managers, nurses, like no matter who we're working with, they seem to have these 4 things in common. And so I'm going to go over them kind of quickly, but we'll be able to illustrate them later in our presentation. So feel free to let us know if you have questions. So and these are in no particular order, they're just the 4 most common. So 1 is you're spending too much time on the wrong things that are supposed to be helping. Like they were intended to help, you think they're going to help, but before you notice you've wasted like tons of time or money or energy or whatever, and you don't feel any different after them. Number 2, you're constantly putting out fires at work. But then who of us can relate to, like, we show up to work and we might have a to-do list, or we might have this like really well-intended plan of like, I'm gonna email all my people back, or I'm gonna check all my voicemails, or I know I have to go to these meetings and see these clients and I'm gonna get her done, but then we show up to work and it is nothing like we planned. We've got emergency voicemails, we've got emergency emails, we've got people showing up to the office that need help right now. So we're constantly like putting out fires, but then we're missing, it's kind of like crisis of the week, if any of you are familiar with that in your therapy work. Like, it's just, our days are consisting of nothing but crises of the week, and we're not able to get to the core or the root of the issue that's bringing in our clients. And that feels frustrating. Number 3 is you feel like you're hitting a brick wall at work with your clients. So maybe you find yourself having the same conversations over and over, or them coming with the same issues over and over, and it feels redundant, or, for lack of a better term, like almost boring. and then you're recognized, you feel bad that you're bored with this, or you're recognizing that you're feeling frustrated with your clients because it doesn't seem like a lot of changes being made. And that may or may not be the truth, but that's how it's perceived by you. And then the fourth thing we see time and time again is burnout. And you're so burnt out, you're crispy, like you are past burnout. So these four things are going to get in the way of us delivering good practice. Agreed? On some capacity, like none of these four things are going to help us meet moms where they're at. So, what we wanted to kind of show you is an example of the practitioners that we most commonly work with and what they come to us, what kind of concerns they bring. We want to see if you guys can relate to any of this. So Kim and I we were thinking in particular of this case manager. We're going to call her Jen for our purposes. And she leads a weekly group for moms at a shelter, at an IPV shelter. She told us before she started working with us that she goes to trainings all the time. She's really lucky, and her agency, gives her a huge stipend to be able to go to trainings, and she's really likes going to continuing education events. She likes learning, but she feels like they're not going deep enough, and she kind of wants more of an advanced training. Which I can kind of relate to. Like a lot of us here at 2020 Mom, like we know the basic stats, we know why we're here. I think one of the reasons why we appreciate and value 2020 Mom is that they dig a little deeper. And so that's what we strive to do as well. Jen was, really good at recommending self-care to her clients, but feels like she's like not giving them enough by just focusing on self-care. Or maybe her definition of self-care isn't robust enough, but she kind of feels like, she's handing them a Band-Aid and really what they need is like a full body cast or something. Like she feels like it's not enough and she wants to be able to do something more. And so we worked with Jen. She attended some of our trainings and went through some of our exercises. And a quote that she shared with us was, "Now the path is way more clear to actually helping me support my clients. I've helped gain focus with my clients and also value strengthening my empathy skills." So empathy is something that we definitely drive home pretty hard because we recognize the importance, not just anecdotally the importance of empathy, but also the scientific evidence that shows that if we're delivering empathy, our clients are more likely to adhere with their treatment plan. Their overall satisfaction is higher. Our burnout is lower. There's less emergencies that will present, like depending on your setting. You'll receive fewer crisis calls. You'll receive fewer ER visits if we're delivering empathy, which kind of can seem non-related, at least to somebody that's not a clinical practitioner. I am a big fan of empathy and love studying it and kind of sharpening my skills in that area. So that's just some of the feedback that we get from folks like Jen, who are doing who are on the front line, right? They're working with moms who are coming in that need housing assistance, that need, TANF vouchers, that need diapers, and then it's a great added bonus if you can actually get mom alone for an hour or so, just so she can do some process oriented, like crisis intervention. Kim, anything you want to add to that?
I just remember feeling like Jen. I was trying to do all the things to support, and I'm not a clinical person. So just in case you guys didn't get that, I do not have a degree in anything clinical. And so my focus is peer related. And how I come to this is, through the birth world. And then as a mom who's experienced multiple mood and anxiety disorders. And so when I was first figuring out how to support other moms, which is the reason why I started teaching childbirth ed classes and became a doula, was like, okay, so I'll just get all the trainings I can possibly get. So I'll have all the things so I can help all the moms. And so I was spending a lot of money and a lot of time, and I do have multiple trainings and multiple certifications, and that's great. But um, I needed this other level, which really turns out to be I was working too hard, I think. And and so our what I love about our protocol is that it's what as I settled into this person centered, really being with um, each mom and each family, um, and really standing deeply in empathy in a way I hadn't ever done it before made a huge difference for me. So I can understand where Jen and a lot of folks are coming from, because we've all like racing to get as many trainings as possible or as many certifications, or and they're helpful. I mean, I learned a lot from all of them, but there was always something missing.
Yeah, like it gets you close enough, but not quite there. And that can feel really frustrating as a provider.
Yeah.
So, okay, so let's give you an overview of each step of the Heartland protocol. Now, we'd be lying if we said that we could give you the full enchilada like in this training in our time together. So normally Kim and I spend a full day outlining in detail these 5 steps and doing experiential exercises about it, learning the research behind it, having really cool discussions about it. But you guys can leave today knowing at least what the steps are and in what order we want to make sure that we're delivering them without skipping to the next step, kind of like at a bird's eye glance. So bird's eye view, I should say. So let's start with H is for here. So we've also it's evolved into here/holding space. So we talk about how to truly listen to your clients in a meaningful way, and we define like the art of holding and what that means, and the art of active listening and truly hearing your clients. And let me also say, we probably all feel like we're doing this, and we probably are doing a great job. I also see it time and time again, especially in the work that I do supervising LMSWs in Missouri that are working on their licensure. They think they're really living in the here and the holding space, and they jump to problem solving. So I always have to remind them to slow down and really apply some here or holding space skills. Because that will help create the ideal environment for your client to feel safe and secure. And that's such an important foundation for a helping relationship. And that will allow us, if we make sure that we're really applying here properly and thoroughly, we'll be able to apply the rest of the steps with even more effectiveness.
And part of which is not reflected here exactly, in order for us to hear and move through the rest of the steps, we have to know where we are, which Elizabeth had mentioned, knowing our why, and then also knowing like where we are in terms of burnout and vicarious trauma and where are we as helpers. And so that's one of the things that we get to do in our as part of our protocol is do some assessing so we can talk about where we are, because we can't improve on anything if we're at the bottom of our bucket. And
Mhm.
boy, over the last couple of years, right, as all the helpers here know, we've all been maybe dangerously close to the bottom of our bucket or there at times. And so, really making sure that we're addressing, our needs as helpers as well as we move through this process.
Mhm. The E in the Heartland Protocol stands for empathize or empathy. I'm a big fan of the superpower known as empathy. I consider myself an empathy clinician. It's not just being touchy feely, warm fuzzy. It's not just being a nice person. There's actually, technique and science behind why empathy is so effective. And so we really, really like peel the layers back and get pretty detailed in the steps of empathy and how to best, deliver them. And we talk about really like common mistakes people make when they think they're applying empathy, and how to make sure that we're not, patronizing or even providing sympathy, which it does not land the same as empathy. So I'm biased because I'm the therapist of our duo, but this is probably my favorite step. I could talk about this step all day long, but Kim, do you have anything to add to this step?
I think it's essential. One of the things I get to practice my empathy all the time in our moms groups and listening to and working with moms on the phone and knowing the steps and knowing how important it is to stay in our empathy even when it feels like we can't spend one more minute there because we just have all the knowledge and we want to share the resources and get to the next step and just knowing I'm so grateful to always be reminded that it is a practice like holding space. It's something we're always working on, and we get to always fine tune.
So A is for assessment. In our 2-day training, we talk a lot about hidden red flags and the things that show up in our daily work with perinatal moms. And we also talk about, this is a very popular part of our training, is we talk about the societal expectations for motherhood and how they're harming everybody, how they're harming moms, they're harming pregnant people and their babies and their families, and even people that are never pregnant. These expectations that we put on moms nowadays, it is causing big problems. And part of our work as helpers in moms' lives or birthing parents' lives is to help them set right size expectations for how pregnancy is going to be and how the immediate and even longer term postpartum period is going to be. In addition to talking about those things which help us make a good assessment of how this mom is going to do, we also talk about paper survey assessments, and but moms need more than just filling out a survey and talking about how they've been feeling for the last 7 days. Those are important. We need to include them in the work that we do with moms, but we want to go beyond those traditional assessments and make sure that we're getting a real thorough, comprehensive assessment, which consists of like how mom is talking about how they're doing, how we see them coping with activities of daily living, and maybe what the paper assessment's saying.
What I love about our protocol is that it can be done um, as we're looking at assessments. I know sometimes folks are thinking, okay, so how long does it take for mom to do an assessment? And now I have to have a conversation with her. And how long is this all going to take? And we really can distill this down to if you've got 7.5 minutes with a mom, you can spend. It doesn't take forever, and so it's not about that you have to have an hour with each mom. Some of us have that luxury of being able to spend as much time with a mom as possible, and then some of us are, pressed for time and knowing that there's some key things we could talk with mom about on top of these assessments to really get at how is she doing is key.
The R stands for refer. And the methods taught here, some of the most misunderstood and neglected pieces we found when working with moms with PMAD. Unfortunately, we all probably have some horror stories of other professionals or maybe other disciplines that really gloss over this or just hand mom a stack of phone numbers and say like, good luck, you should call all these places, as if like mom has the time or energy to do that. So, we really kind of say out loud, and we're very transparent with the fact that just because you handed mom some phone numbers to call doesn't mean that you can check off that box that you referred. Like, how have you made effective, like, doable referrals that are identifying gaps and help? Are you doing warm referrals, and what does that mean? And are you following up to see if mom needed help with any of those referrals? Things like that. So the refer step is so much more than, do you know who and where the places are in your local community? Although that is super important. Ask any social worker, right? Like, We need to know where our community referrals are so we know where to send moms, but it's so much more than that. And so we really kind of break down what's going to make the most effective, like doable referral. And so this is kind of an interesting category where we get lots of lively discussion, because I know we all wish that there were, sometimes it's a matter of like, we all want there to be a certain type of service available to clients. And when clients come to us and they say, I really need this, and this is why I haven't been able to get it, and this is why I need it. And I think we all can relate to feeling like, oh my gosh, I want you to have that. You need that. You deserve that. And I don't think it exists right now.
Mhm.
And it's not your fault. And that is frustrating and that is hard. And what are we going to do instead? And so it's kind of sitting with that, the radical acceptance that's needed by us as providers when sometimes the referral she needs or birthing parent needs doesn't exist or can't access for whatever reason. So it's kind of sitting with that. Because I'd be lying if I said to my birthing clients or to you guys, I'd be lying if I said like, all those places exist. You just got to be a better Googler. Like we have to get past like being a good researcher and kind of also sit with our clients when referrals aren't possible or aren't ideal, if that makes sense.
And I think so much of when we move through our protocol from the listening and holding space to empathy, and then really getting a true assessment, by the time we're getting to this refer piece, we have a better understanding of this mom. So we're less likely to hand a list of things because we've been really listening. And even though she may have a lot of things that she shared with us, that one thing that is going to make her feel better might not even be a phone number. It may be that she just got to say it all and somebody listened.
Mhm.
And so there's so much power in connecting with people that our referrals don't have to be. I mean, it would be great if we had all the perfect ones, but we all know we don't. And so, so important for her to feel like someone heard her.
And I also think it's worth mentioning if the first step of my helping relationship with this client was handing them a referral and I hadn't established a hear or holding space component and I didn't deliver any empathy yet, and I didn't even really assess them properly, they're not going to value the referral I just made to them because it was going to seem like a cookie cutter referral. So see how, some of us, our primary job may be resource and referral, and that is a really important job. And can we make sure that we're, 3 steps before we actually deliver the names and numbers and info, that we're doing the hear, the empathy, and the assessment. And again, this can take 5 minutes, but let's make sure we're doing it because it's going to increase the likelihood of that step you're in right then being as effective as possible and really helping the mom in a meaningful way.
And we want her to be in compliance, right? We want her to do the thing for herself. That's, that is the next best thing for her that we've discussed. And in order for her to do that, she's got to feel like she's been heard. And
Mhm.
so, we're much more likely to see her again, to for her to be compliant with whatever you're recommending, when we've taken the time, even if it's a minute and a half in each of these steps, or maybe it's 3 minutes in one and a minute in another. And the first two, if you can spend 3 minutes there when you've only got five, it's going to make a big difference.
And finally, T in heart is for touch base or follow up. So in our trainings, we discuss what your agency is currently doing in terms of follow up or aftercare programs, and how to retain clients, how to keep them coming in for services, and how to see them succeed and continue to come in for care because you've helped them fall through the cracks. We help agencies craft policies and procedures so that they can have aftercare services if that's something they don't have at all. It doesn't have to be super complicated either. But what is the point of doing these 4 steps, or what is the point with intervening with PMAD clients at all if we're not following up to see if it worked? or following up to see, okay, what do you need now? Or making sure that they know that the door is always open. Because guess what? Moms have more than one baby, and moms deal with postpartum mood and anxiety disorders more than once. So we need to, in order to engage them in that, truly in that perinatal life stage, we want to make sure that we're having good touch-based policies and procedures. Sound good?
Absolutely.
Okay, so I'm going to attempt to show this video.
You're going to do it. It's going to work because our technology is cooperating today.
Mm-hmm.
That's our intention.
That's what I say. So please hold while I figure that out.
Yeah, I'm gonna call it right now. I think I found these single.
Almost there. I promise. I'm gonna see if I can skip the ad. Will you let me know, Kim, if you can see it?
I see it.
Biggest productivity hack of 2021. It's this Google Chrome extension called
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
I know no matter how many times I see that, I so appreciate the distinction about empathy versus sympathy. And just a reminder to not use the word at least. And if it's even coming up in my mind, to remember I'm stepping out of empathy if I'm going to say at least.
Yeah, so I'm a big fan of Brene Brown. I'm sure many of you are as well. I had the privilege of studying the Daring Way modality with her and her team in Texas several years ago. And that's probably why I'm such an empathy nerd. And these are the kind of things that we talk about at length and really kind of tease out, that this isn't just like, well, just be nicer to your clients, or, just tell them all of your stuff so that they know that you know what you're talking about. Like, there is a science to this, and that's why we've developed the method and the way that we have. And a simple tweak, making sure that your perspective is coming from empathy versus sympathy is felt in a very deep and meaningful way. So we just wanted to give you an example of the things that we do and talk about, and kind of what the flavor of the Heartland protocol is. So I highly recommend that you Google Brene Brown on YouTube. You won't be disappointed. Okay, so we've given you kind of, we've scraped the surface on all 5 components of the Heartland protocol. We wanted to share another common experience that we hear from people who take our training. So Rachel is a therapist that we've worked with. She is in private practice, and she specializes in family therapy. And so she sees a lot of birthing parents that are experiencing PMAD. And she is one of these providers that really felt like she was having the same conversation over and over with her clients. She would commonly say that she felt that they were not making any progress, and she felt bad about that. She didn't want that to come off as like a judgment. She wasn't disappointed in client, but she was wondering if it was something that she was doing, or why she felt like that client was not making progress. She also, which I don't think this is a coincidence, was really feeling frustrated at work, was starting to dread going to work, didn't find her work as meaningful or energy producing as she used to, was kind of apathetic. I think we all can relate to some of those things, especially in the last 2 years. I think it's safe to say that, she had burnout. She had some compassion fatigue. She also had a lot of physical problems like headaches, like eating, snacking a lot, and she wasn't sleeping very well. She shared with us that she felt better knowing that she could rely on the Heartland protocol and not have to search for new or convoluted tricks, skills, or therapy modalities. My clients are responding to me in a totally different way. I'm noticing more collaboration from clients, and I'm feeling less frustrated. I don't need to convince, urge, or repeat myself with clients anymore. So she didn't change the modality that she was using in therapy. She does a lot of trauma-focused CBT as well. She just tweaked it with the Heartland protocol, making sure that she was covering those 5 steps in a sufficient way. And she noticed herself changing and her clients changing, which we love to hear. We love to see that part. Kim, anything you want to add? Sorry, I just put you on the spot.
No, what I was thinking about is how freed up it can be when you're not focused on, for me personally, like, okay, so what resource do I have to have for this mom so that I can make it all better? When it turns out that being present with her, listening to her, letting her say what she needs to say is more important than me coming up with the right thing. And I'm not a case manager, but it's kind of like case management light that I do, because I'm helping moms get connected to other resources when that's, part of the need. And so it's taken a lot of time, years, for me to know that that's not the most important thing, is to know all the places. Now, granted, I do, because I've been doing this so long in this area. However, more often than not, I'm not making a significant connection. I'm holding space and listening, and so it's freeing to reorient myself, and so I know that we hear that from so many of the folks that take our training, is that freed upness that happens when you're refocusing just a little bit. Because the work that we do is really hard.
Yeah.
We're in there doing really hard things with folks and listening to really hard things. Um,
And
and
that was true before the pandemic, and it's even more so true now.
absolutely.
So I also think it's important to say out loud that, when Rachel brings those concerns to us, we don't say, oh my God, you're thinking that, or you're feeling that with clients. Like, ooh, don't admit that out loud. Kim and I, we really praise and acknowledge. My cat wants to join us. Sorry, I closed the door, but she doesn't care. We really value authenticity. And so we know that, she knew that she could share that with us and it wouldn't be judged that she, because we do the Heartland protocol with people we work with. So, we had built up that rapport, and she can say, frankly, like, I don't want to feel this way, but I feel this way. And so we meet her where she's at and say, like, well, you're probably doing the best you can. It sounds like you're feeling really crispy. What can you do to support yourself so that you're not pouring from an empty cup and you can show up and help moms, So there's a lot of normalizing in what we talk about, that, like, of course you're feeling this way. What do you need? Of course you're feeling frustrated. Of course you feel like you're repeating yourself a lot. You probably are, because you're at your rope's end, at your wit's end, at the end of your rope rather. And, what I've noticed is you might feel like you're repeating yourself a lot when clients don't feel heard. If we didn't do the H and the E right, they're going to keep coming with the same crises, keep coming with the same problems, because they just don't feel that, like, that click to letting you into the helping process until they know you get it.
Mm-hmm.
And you may know you get it, and you may really get it, right? But empathy, one of the most important steps of empathy, step number 4, is communicating it to client. So if you didn't, explicitly, explain, or not explain, but communicate to them that you see what they're saying and you can tell that they might be feeling X, Y, Z, tell me more, they may not feel heard. So it's just something to consider. We're almost running out of time, so I'm just going to go over these next few slides very quickly. Feel free to reach out to Kim or I on the Whova app. Look us up and feel free to email us if you have any questions. If you want us to answer some questions today, feel free to put those in the chat. So I'm going to try to zoom through these. So just like final kind of catch-all thoughts, we really want to normalize talking about perinatal mental health. That's what we do all day, every day. And we know you guys do too. If you want to learn more about the Heartland protocol, know that we can, like, personalize and tailor what we're talking about to your setting. So, like, later this year, we're working with home health social workers. And so we're going to be talking about what it's like to deliver the protocol just in that setting. In the past, we've worked with folks that are working at a pediatric office, so it does fit all different professions, but we can make it align as much as possible with your specific discipline. We really feel like when we're working on the Heartland protocol, we're helping, create more confident, balanced, boundaried professionals. So, like, you can be way, way, way more compassionate if you're able to set really, really good boundaries with your workplace and your clients. And that's what we talk about, is like how to take care of yourself, is really like how to set boundaries with work and home so that you can have a bit more balanced day-to-day life.
Because I think it's important, Elizabeth, when we say that boundary piece, because sometimes I think that people, like, here we're doing all this empathy work and it's like, great, so now I'm going to even, like, have to give more of myself. And
that's it's actually the opposite. I mean, in a healthy way.
Right. It's being, and that's what that freedom that I mentioned, it's like, it's that flipping of, we're not asking you to give more. I know that when we have worked with some doctor's offices in the past, it's like, oh, great, so now we've got to do even more. Nope, there's a way to do this that's actually going to save time, because you're going to be more clear in your boundaries. And it's not like you have to put up a plaque with your boundaries. It's going to be in how you follow this process.
Yeah, because the Heartland protocol itself is containment. It's like, if you do heart, you're good.
Mhm.
You don't need to go outside of it, you know? So I mentally think in my head, where am I? Have I done the E? Is it time to go to A? And that's how I think. And then when I've addressed T, I know that I've done a good job. And I know that the likelihood of client coming back if they need something is high, and it won't necessarily be because they're in crisis.
Right.
So, you know, if you might not be able to tell, you know, we're talking pretty fast over the last hour with you all, but Kim and I do real talk. We do vulnerability, we do authenticity, sometimes that means we curse like sailors. Sometimes that means that we use humor. You know, like we're real people, and we let our clients and our birthing parents and all the families we help know that we're real. We also have boundaries. But we found that, well, one, that's just how Kim and I are, and that's probably why we gravitated towards each other and do such good work together, you know, but also we find that permission to be authentic is very validating for the people that we work with, and comforting in a way. We want to work with helpers who get it, which by default's everyone here, certainly, or at least the folks that want to get it, you know. So, you know, not to like bring up a bad news, but like we all know colleagues or people that we've worked with or have worked with our clients that did not get it. They don't get it. They don't want to get it. We're not going to be for them. We want to work with folks that like agree with, you know, where we're coming from and can identify with some of the like the case vignettes we've shared with you and some of the stories that we've shared with you so far. And it's safe to say that if you're aligned with 2020 Mom, you get it. And we all know that moms deserve better. Doesn't mean that we're not already doing a great job. It just means that like moms deserve the most, you know, and we want to show up for moms. Okay, if you're interested in coming to a annual training where we approve providers on the Heartland protocol, we have one coming up in May. All the information's here. We've secured a special discount for all 2020 Mom attendees. So not just those of you that are live with us right now, it's for folks that watch this recording or on the Whova platform for the event. This week, if you use code 2020 Mom, I believe it's 10% off our early bird rate. So you'll get the best rate possible. Some of the things that you'll get as an attendee at our Heartland protocol training are 12 CEs. You'll get curriculum. You'll get listed on our approved registry of providers. Can you see that?
Yeah, they went
there. Yeah, so we have a provider registry of folks that have taken our training and what their discipline is and how to contact them. So that's something that you will have access to by virtue of being at our training. Kim, start talking because I'm gonna
you have to go back. And so we have 4 minutes left, and we'd love if there's any questions, we'd be happy to answer them. I don't see any in the chat. I guess I should look at the chat. But we're happy to answer anything if anyone has any questions in these last couple moments here.
We also do private trainings and private consultations, so please reach out. Our info is on the margin of this slide. It's basically either Kim or Elizabeth at heartlandpmad.com. So feel free to reach out. We look forward to meeting you.
Thanks, everyone. Are most of your providers care coordinators or counselors? That's a good question. Stephanie, we actually are, the folks who take our training vary. So we've got home health workers, we have childbirth educators, birth doulas, chiropractors, pediatricians, nurses, and of course, counselors and therapists, and so MSWs, LCSWs.
And that's a cool thing about attending one of our live trainings is that you're going to meet other disciplines and talk about the same case studies and figure out like, we're all going to have different roles, but how can we all use the same protocol to get to where we want to get with our clients? So having said that, we can always tailor something. Like we have worked in the past with just a group of doctors or just a group of case managers, but I really appreciate the diversity of who's represented at our trainings.
And then we do provide ongoing support for those who've gone through our training. We have quarterly gatherings with our approved providers, and some special events, and our approved providers are always welcome to reach out, and that's where we get some of these case vignettes that we did today, by working directly with the folks who take our protocol. So yes, we're here to be supportive. And so even for folks who are watching this today, if something's coming up for you and you want to reach out to us, we want to help, because we know that the more we can support providers, the more moms get supported, and that's what we're up to.
All right, I think we hit the nail on the head with timing. Thanks, everybody.
Awesome. Thank you, ladies. Thank you all for joining. See ya on the main stage. Take care.
Thank you.
Yeah.
Thank you.